These 5 things could be ruining your lower back and preventing you from finally being pain-free. As a chiropractor, these are 5 things that I would never do for back pain. And I've helped thousands of people around the world fully recover from lower back pain, sciatica, and disc herniations. And in today's episode, number 127 of the Low Back Pain Podcast, we are going to dive into exactly these 5 things that you might have been told from your doctor that could be ultimately causing harm and holding you back from being pain-free. Real quick, if you have not joined my private Facebook group yet, you need to do so. It is called RehabFix Low Back Program. And immediately upon joining, you will receive our free step-by-step sciatica guide. This is the same process that we have taken thousands of our clients through around the world to identify exactly how to fix their sciatica and ultimately become pain-free through our one-on-one coaching program. In this group, you will be able to see our clients and what they're doing for success and additional resources and more free guides. So if you're serious about fixing your back, you need to join this group, RehabFix Low Back Program. See you soon. The first thing that I would never do for someone with back pain is tell them that their spine is out of alignment. I don't even know what that means. People are told this all the time, that they're out of alignment, their hips are out of alignment, their spine is out of alignment, and this is the cause for their pain. But it's just not true. Why? Because everybody has normal variations of skeletal formation. Everybody has a little bit of curvature in their spine. Everybody's hips are pretty much uneven. In fact, 90% of the hips on people are uneven. So that means uneven hips are normal. And out of alignment is just not specific. It's not directed towards anything. It does not tell us how the person moves or how they function or anything else that they can do for themselves. Out of alignment is an old myth type thing that people have been using forever to try to explain pain, and it is not accurate. Telling someone they are out of alignment causes fear, a feeling of fragility, and it is not helpful for a confident mindset on one's pain journey. Number 2, I would never tell someone that we need x-rays or an MRI to see what the problem is. This is also outdated procedures for lower back pain because we know that there is a mass abundance of asymptomatic findings on imaging, and it is well documented that premature imaging can cause more fear, more problems, and poor course of treatment. If we were to take x-rays and MRIs of thousands or millions of people without any pain, we would find presence of degenerative disc disease, arthritis, disc bulges, and many different things like these, and they don't have any pain. So if you are suffering with pain, and then we take an image, we are going to blame whatever is seen on that image for your pain, and it could be the wrong thing, or you could be provided very scary information on that report, and it could simply cause more fear and cause an incorrect path for what you should do to resolve that pain. Because ultimately, your care and your rehab should be dictated based on a proper physical assessment, not based on imaging. Imaging has a very high false positive and false negative finding rate and can simply cause more confusion on what you might need to do for appropriate relief. You might be struggling with some lower back pain, but you might not be that concerned. But then if someone says, oh, you need an x-ray or an MRI, and then you see a disc bulge on there, and then you're told, oh my gosh, you have a disc herniation, it's terrible, you need to go to surgery now, you need injections now, all of a sudden, you're in a whole bunch of trouble that you wouldn't have been otherwise if you had sought proper conservative therapy and received a proper assessment. So this information that can be gathered from imaging can be harmful, and it can be disastrous in certain circumstances.
Quick interruption. If you're listening to this podcast and you're resonating with the things that I'm saying and you're finally ready to be pain-free and you don't have a plan and you're not sure how to get there and you're just looking for that guidance, then visit the link in the description or the show notes below. You can schedule a free initial call with my team and we will actually go over your current regimen, go over what you should be doing, what you should not be doing, and how a better plan might potentially show you how to get to that pain-free state that you've been looking for so that you can get this over with and back to living your life. So if you're ready to finally figure this out, then visit the link below, schedule a call with us. Looking forward to helping you. Back to the show.
Number 3, I would never tell you that I can just crack your pain away. Many people seek spinal manipulation or chiropractic adjustments for back pain. And although it can be very helpful and very palliative, and although that can be very helpful and relieve your pain, it is not the only thing necessary to remove your pain. You cannot achieve a full pain-free life and full change in function and full change in movement just by getting cracked alone. That is a good but temporary effect. So you must have a proper rehabilitative plan that involves movement and exercise to go with these spinal manipulative or other passive therapies. We cannot just crack your pain away. That is not sufficient. You need to have an additional plan to go with that for full long-term relief. Number 4, I would never tell someone to rest their pain away. It is also well documented that rest is not good for lower back pain, can cause more pain, more fear avoidance, more fragility, and it is not helpful. Movement must be a part of the rehabilitative plan for lower back pain. It must be involved. Movement is medicine, and the right movements and the right exercises will fully resolve your disc or sciatica condition. So if we are taking away all forms of movement and just telling you to just lay on the couch and not do anything for your health, not do anything for your body, how could we possibly expect that to be anywhere near a solution? This is not good advice. This is harmful advice. And in addition to this, we have had many online clients who were told to not only go on bed rest, but to quit their jobs and do nothing for weeks and months. This leads to more complications, more time lost, more money lost, and just complicates everything. I would never tell someone to rest their pain away. And number 5, I would never tell someone that they need to keep coming back in order to stay better. The same old traditional methods for fixing your lower back, such as typical PT clinics or chiro clinics, will typically leave you with the impression that you need to keep coming back in order to stay better or stay in alignment or to keep feeling good. Although there is some truth to having some form of maintenance of movement, you should never need to rely on a healthcare provider in order to be better. If that is the scenario, then you are being forced to be dependent on these individuals. And you are obviously not being taught what you can do for yourself and how to ultimately take control of your condition. If you have to keep going back, then you are not healed. If you have to keep going back, then you are reliant on somebody else. You should be educated on what you can do. You should be educated on the right exercise and the right movements so that you can achieve long-term results. And if you are not being taught this, then you are on the wrong path of care because you should never have to keep going back for results. This is a fallacy and this is a lie, and you deserve better than that. Now, if you've been told any of these 5 things, don't worry. It is not too late. You can still certainly get better. You just need to be aware of the wrong information because remember, bad information can cost a lot. So the more bad information you get, the more valuable good information becomes. So you are not too late if you've been told any of these things. You just need to pivot and start working with a program that is aware of these things, that can be on your side. It can help be your advocate towards full long-term health and put you in the driver's seat and put you in control. Because you deserve to be pain-free. You just need a plan to do so, and you need to learn how to fix yourself so that you ultimately do not have to rely on anybody else and you can be in charge and live your life the way that you deserve.
Once again, be sure to join my Facebook group, RehabFix Low Back Program, so you can get additional exclusive content and our free sciatica guide immediately upon joining. And you can look at the additional upcoming content that we are created just for individuals in that page. It is a great way for you to join a community of serious, intentional individuals, and you can get to see some of our clients winning as well, so you can get a real idea of what is possible for you. If you are watching this on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and help reach more individuals who deserve to get results, who feel like they're spinning their tires and getting frustrated in doing so. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.